Hi, my name is Becky. I'm a paramedic. I treat patients in a pre-hospital environment. The scope of my practice is ever broadening, from transporting patients to managing and treating patients so they need never go to the hospital at all. This is partly due to ever-increasing association to patients with chronic conditions. However, today, my station has been called to transport Cara Lovegrove, who has been involved in a road traffic accident. Before Cara has even arrived at the hospital, her experience and information has already been passed through multiple allied health professionals. It is easy in such a fast-paced setting to treat Cara as a patient who is there to be treated rather than as a person who can discuss and be involved in her care. The approach to patient-centered care hopes to improve the practice of all allied health professionals, allowing her to be part of her own health journey in as much capacity as she chooses. It is crucial I gain all the information I can in the handover so I can better take care of her. It is my responsibility to make sure the nurse knows everything that I know.
Hi, Cara.
Hi.
My name is Nicole. I am the emergency nurse that will be looking after you. Now, you did tell the paramedic on the scene that you identify as an Aboriginal woman. Would you like to know more about each other before we begin to treat your injuries? Or, as I can see you're in pain, shall we just skip through to business and tell me what has happened?
Oh, I don't really care about talking about me. My leg hurts a bit, but I can deal with that. I'm worried about my family. I'm the one that's supposed to be looking after them, and I've left them abandoned in the car. Oh, and Kyle too. Can you tell me about what's happening to them?
Okay, Cara, so my role as your nurse is to make everything go smoothly for you here and make sure all your physical, emotional, cognitive, social and spiritual needs are met to the best of my ability. I'll be checking in with you periodically and assessing your responses to any treatment. I need to make sure you are physically okay first and foremost, but I also am going to find out all I can for you about your family. I'm going to organise an Indigenous Hospital Liaison Officer to come meet with you. I also want to check if there are any culture issues that you need us to know, such as not wanting a male doctor, men's or women's business, or anything you want me to pass on to your family's doctors for them.
I don't mind about having a female nurse, but I know Jimmy will want a male nurse and a male doctor.
Okay, well, I'll make sure to talk to the nurse and doctors that will be looking after your family. At this point in time, I will only be able to make a guess for how long your visit would be. We will know more after the surgery. Are there any medications you take or allergies that you know of?
No, I just take multivitamins.
Okay, so Becky, is there any more information you can pass on to me that Cara may have left out?
Yes, Cara, you said you had some lumps in your neck. You didn't know what the cause were?
Yeah.
Okay, great.
My name is Maddie and I am a pharmacist. My role includes monitoring medication usage, counselling patients, providing drug information and advice to health professionals. Cara's doctor and I will work together along with Cara herself to create a medication plan that she is comfortable with and finds easy to manage. As Cara identifies as an Aboriginal woman, it is important for me to determine if her culture and beliefs impact upon using certain medications before we start discussing our treatment plan.
My name's Nafisa, the podiatrist here at the Royal Brisbane Women's Hospital. I'll be working alongside the other healthcare professionals during Cara's recovery journey to achieve the best health outcome for her. As a podiatrist, we are specialised clinicians that are able to diagnose, treat and advise patients on a range of problems, injuries and conditions of the foot, ankle and leg from below the knee. Podiatrists can offer treatment for the numbness and discoloration of the feet post-surgery and after radiation therapy treatment.
Hi, I'm Amanda and I'll be the radiation therapist working with Cara throughout her cancer journey. As a radiation therapist, we use imaging technology, particularly in CT scan form, to find the location and spread of cancer throughout the body. We then use radiation to effectively kill the cells in the area where the cancer is located. As it is a targeted treatment, it means that there are no systematic complications, unlike with chemotherapy. Radiation treatment can result in a variety of side effects, but most are targeted and localized due to the process of the treatment.
Hey Cara.
Hi there.
So you don't have to repeat yourself. I've brought together your pharmacist, radiation therapist and podiatrist to discuss any concerns you may have before being discharged tomorrow. We should try to cover all your concerns so you can leave feeling prepared for your recovery journey at home with your family. How are you feeling about everything?
Well, I appreciate this, Nicole. I'm looking forward to being back with my family. I'm just a bit concerned how I'm going to look after myself and the needs of my family.
Well, I have organised the Indigenous Hospital Liaison Officer in Townsville to contact you for any questions you have in this regard. They may refer you to some of the allied health services available, such as a psychologist. I think you just have to remember there is support for you and to try and get the support preemptively. Self-care is super vital to your stress reduction and will give you more energy in the end for your family.
Okay, I understand. I was just wondering if I could also incorporate traditional healing into my process?
Yes, you can, but any additional food or medication is prescribed by
by a traditional healer must be checked with your GP first for any adverse reactions. It should be fine for you to continue with your daily multivitamins also.
What will the cost of these medications be?
Well, fortunately, you'll be eligible for assistance under the Pharmaceutical Benefits Scheme, so your medications may be subsidised. Your GP can discuss this in more detail when you see them at your next appointment, and you can also use the NPS Medicine Wise app to be able to track yours and your family's medications.
Okay, I just have another question. This rash on my neck has been driving me crazy. How long will it last for?
It can last for a while. It depends on the individual person. If it does get worse, you should see your GP.
And what are the chances my cancer will return?
If you have any concerns or change in illness, I recommend visiting your GP or oncologist, and make sure you attend the follow-up appointments in Townsville. If you continue living your healthy lifestyle, that will promote overall health and well-being post-treatment.
And how much do these medical imaging appointments cost me?
This will depend on the individual medical imaging department and whether it's covered under the Medicare benefits scheme. You'll have to ask the individual provider, or your GP can give you some more information.
What are the potential long-term effects of radiation therapy on my feet?
Kyra, there will be some initial numbness, hypersensitivity and discoloration in your feet, and your nails may become ingrown more often. However, there shouldn't be any long-term effects that would impact your lifestyle.
Okay, and what happens if I experience any changes?
You'll need to see a podiatrist in Townsville. It may be covered under the Medicare Enhanced Primary Care Plan.
Okay, and how long will my recovery process be?
It usually takes 4 to 6 months, but if you feel any changes in your symptoms, please consult your GP.
Okay, thank you.
I hope that's covered everything.
It has, thanks very much.